It started in July 2013 with double vision, and I went to a neuro-ophthalmologist in order to figure out what was going on, and then they sent me to a pediatric ophthalmologist, which then ran the whole spectrum of Graves' disease markers and blood work, and that's when they found that I do have Graves' disease, and I went through various other testing to confirm that diagnosis. Once I knew it was Graves' disease, nothing really happened. It started in July 2013, and then come the Tuesday of Thanksgiving of that year, started horrendous pain. And then I went to a so-called Graves' disease specialist down in Northern Virginia, and he looked at me like I was completely crazy. He didn't think that I had the pain that I was truly describing. He thought I was, drug seeking, narcotic seeking. And then the pain continued, the steroids didn't work, and I eventually weaned off. So it went into the next year, and I was having more trouble going to work. So I tried to seek out other, physicians in the area that would help me. I went all over the metropolitan DC area. Nobody could help me. Everyone said, you've done what we would do. Nothing. So that's it. I was just on painkillers with a pain specialist until, 2015. Here we are, ready to have surgery with Dr. Douglas at the Kellogg Eye Center. Since I started at Kellogg, everybody has been more than fabulous. I mean, I have not had a greater experience at any facility that I have been to, and I've been to a great deal. So they have understood my symptoms and said that they deal with them on a weekly basis, which is great because nobody had heard of them or accepted the fact that I am in pain and that I do have issues. The doctor is fabulous. He answers all my questions, spends more than enough time with all the patients, at least with me. I am having the orbital decompression surgery, which is removing about 2 cc's of fat from behind my eye, and that will relieve the pain and the pressure that I'm experiencing. Well, I have only surgery pain. The behind my eye pressure and pain has pretty much decreased and been non-existent, and now it's just the surgery pain. So hopefully once that subsides, I will be my normal self again.
Yeah, well, I know that not a lot of people understand the pain behind the eyes and how it gets affected in Graves' disease, but I'm glad that hopefully this will put this behind you. I know the Botox was a little bit of a help, but usually taking away a little bit of fat does a great job. And you're looking fantastic for only 2 days after surgery.
Yeah, I don't think I look too terrible, but it's to be expected.
How was your experience? Is there anything that we can do better or that you can think of that...
Just putting the word out. I mean, just finding you was kind of happenstance, but just being able to be here and have some answers and actually get a solution to my issues has been a miracle in itself. And now that I have my life back, I'm thrilled to finally be myself.
Well, it's our pleasure. We'll keep good track of you, and you let me know any problems that come up.
All right, thank you so much.